Welcome to Health Improvement Visionaries, otherwise known as HIVLLC. My name is Dr. Suzanne Robinson Davis, and I am the owner and principal consultant. Welcome to my first YouTube video. I'm so thrilled. It has been a long time coming. So a little bit about myself. I have worked for 20 years in sustainable development across 4 countries with a focus on health. I want to use my vast experience and expertise to work with you to tackle the diverse, persistent, and emerging challenges that are impacting minority communities and their health outcomes. So I have been working in the US and Jamaica for most of my life. I've also worked in South Africa and Southern Africa. I have done consultancy in the Caribbean also. And now my work in Canada has begun, and I'm very excited about the possibilities of improving health outcomes for vulnerable and minority communities. And if possible, I would love to work with the indigenous populations. On this channel, my mission is simple. It is to support you, visionaries, to improve your work in community health, in addressing minority and vulnerable populations. On this channel, we'll be creating content specifically for you program leaders implementing community health programs. When I worked as a program director and senior director, everyone looked to me to solve all their problems. And where do I look? I believe you are in a similar position. You also want someone or a community where you can turn, a place where you can look for advice and to support you as you make critical decisions. And so below in the description, you'll find my website. You can go and send suggestions. I would love for this channel to be interactive. So your comments and your suggestions on topics, which can include the challenges you're experiencing now, maybe discuss methodologies and approaches to your work, case studies or examples of what you're going through, and asking for suggestions. So you could submit those to me, to this channel, and for us to, as a community, to respond to you. Please visit my website, HIVLLC.com, or send me a direct email at suzanne@hiv. But first, as part of my ongoing research, I am interviewing leaders whose responsibility it is to implement community-based programs addressing minority and vulnerable populations. If you are interested in this research, you want to be a part of it, you can check out my Loom link in the video description below. And if it is of interest to you, I would so love if you would reach out to me. One of my goals is to transform and equip you to be better program leaders in your various settings across the world. Yes, I do hope that my channel will go beyond North America and the Caribbean into other parts of the world. I believe that we have a shared goal, and that is to improve the health and well-being of our populations. Video creation is quite new to me, and I must say I am intimidated, and I've been for a while, and so it took me months for me to get right here. So I celebrate this opportunity to be in front of the camera just talking with you. So I'm very happy and motivated. And so I will be posting modestly, maybe 2 posts per week. And if it is that you want to see more and you are interacting and sending your comments and your feedback, it will motivate me to do even more. I am truly excited, and I know you are too. My engagement on social media is to build a community of visionaries who can look beyond the broken health systems and focus on empowering our communities. I know together we will work towards achieving amazing outcomes, reducing health disparities, and creating healthier and more resilient communities. By seeing the real impact of our efforts, we will not only recognize the value of our work, but also be even more inspired to push forward and do more. So let us work together to make a difference and drive meaningful change. So if this sounds ambitious and even reasonable, please share with your colleagues and your friends. My website link is below. Spoiler alert, like my son, secrets are meant to be shared. Our first series will address managing your reporting process. I know this was an area that I struggled with, and I have had several comments from other program leaders who have expressed this challenge. So stay tuned and wish me luck. But don't just wish me luck. Support me by liking and sharing my videos, and yes, subscribing. Thank you so very much. I am again thrilled to be here, and I do hope that we will begin a journey together that we will never forget.